Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Traci Sweet. She's a healthcare executive. Today's Kevin MD article is The Role of Contingency Management in Addiction Treatment. Traci, welcome to the show.
Thank you so much, Kevin. Glad to be here.
All right, so tell us a little about your story and then tell us about the events that led you to write this Kevin MD article.
Yeah, sure. So I've been in the behavioral health and addiction treatment space for more than 30 years now, and the industry has led me. I practiced clinically as a doctor of clinical psychology for a number of years and went into administration in the end of 2016, having, sort of paid my dues in practice and inpatient, outpatient practice, et cetera. And what I've learned, I guess, since those years of going into administration and now working with providers and coaching and teaching providers is that we have an opportunity, particularly in 2025, to really shed additional light, to learn more about the way to treat people from bedside manner to innovation, to the use of AI, to the use of technology, to help more people be successful.
Mhm.
So in 2023, I joined my business partner, Jason, and we started Whole On Health. And the reason that we started Whole On was because we saw this opportunity to add innovation that filled gaps in treatment. When we've been talking about cognitive behavioral therapy and medication assisted treatment therapy for years and years and years, and yet we're still not winning the war. We're
Mhm.
still not winning that battle and helping more people be successful in recovery, whether it's in the criminal justice space or everyday person space. The numbers are abysmal. So we have an opportunity to look at things through a different lens. And being an innovator and someone who's progressive and forward thinking clinically, it was my chance to sort of put that forward. And that's how we came up with contingency management and adding that to positive psychology and solution focused therapy to develop our program.
All right, so tell us a little bit about some of the gaps that you mentioned when it comes to substance use disorder, and then talk about how some of your approaches can fill those gaps. So what are those gaps?
Yeah, sure. So, first, if you think about just traditional healthcare, we don't go to the doctor thinking that it's a negative experience.
Hmm.
We want it to be a positive experience. So, from when we were little, you go to the doctor, they either give you a shot or you get a lollipop.
Hmm.
If you got a lollipop, you would want to go to the doctor. Instead, you get shots.
Hmm.
So when you're young, your mother says you've got to go to the doctor, and you say, "Oh my gosh, am I going to get a shot?" It's that negative experience that keeps you from wanting to go back. That's traditional treatment, even as adults. We go to the doctor, they say your A1C is high, your cholesterol is
Hmm.
bad. You've got to do X, Y, and Z. You've got to lose 30 pounds. You've got to exercise. Want, 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 want. It's negative, negative, negative.
Yeah.
Imagine going to the doctor and having them say, you know what, you're doing great and things have improved. Here's some other suggestions, but gosh, I want you to keep doing more of this and keep doing more of this and ignoring the negative noise. Then you would want to continue. If we do that in substance use disorder treatment, would more people be willing to engage? Would the stigma be less? Would we show less judgment as providers? And the answer to all those questions is yes. So in our practice, when we find people coming in that are voluntarily coming because they need help,
Hmm.
the things that we should not do with them, we should not shame them. We should not judge them. We should not ask them to go back and revisit their history, their trauma, have to tell their story of how they ended up here. Yet that is what we do. We take them back in an attempt to take them forward. Positive psychology says, okay, you're here. I understand you have a problem. And where do you want to go? What do you want to do with the rest of your life? What are your goals? And how can I help you get there? When we now have treated at Whole on Health, we've been treating thousands of patients. When we say those things to people, they are immediately taken aback. You don't want to hear about X, Y, and Z.
Hmm.
No. What today's the first day of the rest of your life? Where do you want to go? I'm not as concerned with what's in the rearview mirror. I want to help you move forward and as such, reward your successes going forward. The way to do that is via positive psychology and the use of contingency management. And that's where my my article came to you. It was in understanding that basic positive reinforcement works. Punishment, negativity, and judgment do not. And that's how it came to be.
So when it comes specifically to substance use disorder, give us some examples. You had a case study in your article about how positive psychology and contingency management, how does that play out in action? What does that look like?
Yeah, sure. We have at Holland Health, we work almost predominantly with the criminal justice system, with the intersection of criminal justice and healthcare. And so many people are referred to us from their probation officers. They are coming out of incarceration. They need help, they need services, but they have been traditionally shamed and judged by providers. So they have a very negative opinion of us as doctors and MDs and NPs.
And when you say that they're shamed by their clinicians, well, like what does that look like? What's said to them?
Yeah, well, it's not even just their clinicians, it's their family members saying, why can't you just stop?
Hmm.
Why did you have to get into this? Why did you steal from me? You're horrible. This is awful. You're hurting me. You're hurting your family. Those are the things that they're hearing over and over and over again. There's the shot. There's not the lollipop.
Hmm.
Um, so when they come to us, they're reluctant to engage. They have a negative view of us as people who are going to perpetuate that pattern in their lives, are going to judge and shame, and we don't. We treat them differently. They're immediately at ease, knowing that we're not going to ask them to repeat their stories. We're not going to tell them how horrible they are. We're all one bad decision away. We really are.
Hmm.
And then we use contingency management to reinforce the fact that they even showed up, that you came and you stayed with me for 30 minutes, that you answered my questions. From there, developing a treatment plan with their goals in mind, not my goals. For example, we have worked with a number of people who are unhoused, who have been homeless, who are living in tents. Normally, many providers would say, well, then we need to get you housing. When that's been said to some of our clients, they say, no, that's my family. That's my social circle. I'm content being unhoused. These people are my backbone. They're my friends. I don't want to move out of my car.
Hmm.
I'm happy there. So for us to put our goals on a person is just not acceptable to me. What do you want to do? If you're comfortable being unhoused, how can I help you? What do you want to do? It allows them to have some executive decision over their own lives, to take responsibility and be accountable for where their lives are going. And for us to just, I think of it in terms of a mother duck. We just get to sort of move you, and try to keep you on track and support your walking and support your flying. Doing that, allowing them to have incremental goals as we develop that treatment plan, and then positively reinforcing their small achievements cumulatively, we find that there's a transition moment where that reluctance to engage suddenly becomes an opportunity for them to get more lollipops and less injections. And they now want to engage because it's positively reinforcing. It's replacing the dopamine hit that they used to get from drugs with now a wellness and a preventative medicine perspective and something that genuinely makes them happy, feeling success. It's that same dopamine hit given in a positive way.
And for those who aren't familiar with the term contingency management, what exactly is that?
Contingency management is old school. It is receiving a reward.
Hmm.
Sometimes it's an item, might be a raffle ticket or some other, some other reinforcement that is a reward for doing something that we would consider pro-social or good behavior. So we may, those of us that have children, I'm a mom. I used to give my son $1 for making his bed, and he would get a star on his chart. That's essentially the same principle as contingency management. It goes back to Pavlov and the dogs and conditional and operant conditioning and reinforcement.
You mentioned that a lot of your clients, they got the shot, right? They're continuously exposed to negative reinforcement, just negative language. And then when they go and utilize their services, they have a more positive approach, positive psychology, contingency management, and then they eventually have that transition point, as you said. How long does it take before And I know everyone's different, but in general, how long does it take before they have that transition point after being exposed to perhaps years of negativity?
Sure. Yeah. That's a loaded question. Extincting behaviors sometimes takes a really long time with a perfect plan. Contingency management itself is meant to last 4 to 6 months. It's a short-term intervention that we hope to sort of titrate down. And we've seen that to be consistently pretty accurate. Some people adapt to it very, very quickly. They're immediately engaged with our digital therapeutic app. They're immediately engaged with their providers. They're earning small incremental
Hmm.
10 and 25-cent rewards that are so meaningful. It's not about the dollar value, it's about the dopamine and
Hmm.
that positive experience. But generally 4 to 6 months, we start to sort of pull back a little bit. They're not necessarily getting as many rewards for smaller things. They're now getting them more for the bigger things. So essentially, the Biden administration increasing the cap on what we could offer in terms of rewards as contingency management did help us sort of titrate that. But in generally, we think 4 to 6 months for people to establish a behavior that then becomes rote. Going to AA, they're reluctant to go to AA.
Hmm.
Over the course of time, they meet a sponsor. They make a new social circle. Now they want to go to AA to see people that they enjoy being around or that support them naturally. And it's less about getting rewarded for going to the meeting. It's more about, I want to go to this meeting because I get to see so and so.
So give us a case study. It could be real or hypothetical about how some of these rewards can really change that behavior. What would some of these practices look like in real life?
Sure. Well, the best way to implement something like contingency management, and it's evidence-based, has been around for an awfully long time, but it's been difficult to implement traditionally, at least to maintain. We do it through the use of a digital therapeutic application that allows people to earn rewards. It's easy to replicate and it's easy to deliver. So for example, someone logs into the app, they complete some psychoeducational lessons, they do two a day, they get a positive affirmation, they get a monetary reward just for logging into the app. By the end of day one, they've earned $1.50.
Hmm.
Every day that accumulates. For Whole on Health, they're able to withdraw that money onto their debit card, and then that reward gets exponentially larger and to a larger audience. Now, for a husband who, it has Mother's Day this weekend and wants to do something nice for the mother of his children, he's got $35 on his debit card that, he can take the kids out and they can go to Chuck E. Cheese. There's that sense of I'm doing something really good with my life
Hmm.
and I'm able to take my wife. And now it's not just our client who is the dad in this situation, the husband, but he's also had a positive impact on his family. And he then hears that reinforcement coming from his kids and his wife. So it just grows exponentially and really leads him to having some self-fulfilling positivity in his
Hmm.
life.
And who funds these programs? Who funds these rewards? You mentioned the Biden administration. Is this a government funded program? So tell me about that.
Yeah, so the Office of the Inspector General has put out letters that say, contingency management is a particularly effective intervention for people with SUD, particularly for methamphetamine, for cocaine users where there is no medication-assisted treatment. In cases where there is medication-assisted treatment, it's a great augment. We're funding this through Medicaid dollars, through remote therapeutic monitoring, and through our own, reimbursement rates for our other services. Whole on Health as a hybrid model has the digital therapeutic application, but also has providers that are providing standard telehealth services, whether for counseling, peer recovery services, E&M codes for traditional PCP-like care as a transition to community-based. So we take care of that out of our return on investments that we do with the clients. It's up to $50 a month. They earn about $500 a year. They have the ability to earn about $500 a year. And it's supported by our government, which is great. And it allows us to offer it.
We're talking to Traci Sweet. She's a healthcare executive. Today's Kevin MD article is The Role of Contingency Management in Addiction Treatment. Traci, let's end with some take-home messages they want to leave with the Kevin MD audience.
Sure, yeah. If you are a provider and you're looking to add some innovation and some augment to traditional therapy, to, an independent provider association that is struggling to deal with people who are struggling with addiction and substance use disorder, think about partnering with an organization such as Whole on Health that can add adjunctive therapies in ways that you may not want to. Community-based mental health providers, we don't want to replace them. We want to help them treat more people and augment services that they may struggle to deliver using a digital therapeutic, using more innovation. So, we're here and please check us out on wholeonhealth.com and of course, Kevin MD for the article that I wrote on contingency management, and we're happy to help.
Traci, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
My pleasure, Kevin. Thanks so much.